Mental health is one of today's most significant healthcare issues. 1 in 5 Canadians will experience some form of mental illness in their lifetime. So the burden of mental health issues on our national healthcare system is increasingly complex and worrisome. Equally worrisome is the fact that many Canadians do not receive the mental health care and support they need. Those who seek mental health care often look first to their family physician. But to be effective in providing proper mental health care services, there must be greater collaboration between primary health care and mental health care providers.
Mental health really reflects an individual's overall emotional well-being, their ability to form relationships, to participate in the community, to be able to meet the needs of others in their community, to be able to ask for help when it's required. We need to think of it not as a kind of separate area, but something that we can integrate into the care of any individual dealing with any health problems.
Mental illness is no respecter of age, gender, or ethnic origin. The term itself is a catchphrase for a number of disorders: anxiety, mood, depressive, personality, eating, substance, schizophrenia, and other disorders.
Mental illness is so complex, and there are many different ways of understanding it, many different components that cause mental illness. There are biological components, psychological, social, and there are the ways of understanding it can come from the medical clinical approach that service providers often take, but there are also sociological ways of understanding mental illness in terms of homelessness and poverty. There are cultural ways of understanding it. Different cultures have different understandings.
We know that health, as it's been defined in the Canadian system, is more than just the absence of illness. And in fact, there are many dimensions to health. And when we think about health, we think about people's psychological well-being, their ability to contribute to the well-being of their community, to raise children, to carry out their activities of daily living.
Some forms of mental illness are obvious. People on the street, homeless, wandering. But the majority of people with mental illness are invisible. Family members, friends, neighbors, the people we pass every day. Their challenge is to try to carry on a normal existence while coping with the often debilitating effects of some mental disorder. What they share is the stigma that continues to surround mental illness. And many do not have access to the level of care and support they need. That was the case with Cynthia Clark and her son Justin Perkins. His early signs of schizophrenia went undiagnosed for over a year. The support they expected wasn't there.
When we discovered how difficult it was for us, we realized that it was difficult for a lot of other people as well. And we started talking to a lot of other people and found that, a lot of families are so overwhelmed and they don't have the support that we had from our family and our friends, that to take the extra energy to go out and look for these resources and fight for them was beyond their capability.
I think we have to think again about the way we deliver services. Many of the traditional ways of delivering service, expecting people to come to us rather than going out to where individuals are living or where the problems are, isn't working as well as it should be. So I think we need new approaches and we need new kinds of relationships between different sectors.
And that is the challenge for the Canadian Collaborative Mental Health Initiative. Funded by Health Canada's Primary Healthcare Transition Fund, this initiative brings together 12 national organizations that represent community services, individuals, families, self-help groups, dietitians, physicians, nurses, occupational therapists, pharmacists, psychologists, psychiatrists, and social workers. Their shared vision is a future where Canadians have easy access to mental health services from their primary health care provider, and where mental health care and primary health care providers, consumers, and families are working together to achieve this. This vision is captured in a charter, a collection of key principles and agreements that is the hallmark of the Canadian Collaborative Mental Health Initiative.
I think this is one of the most important things happening in the country at the moment. There is an incredible investment being made of time and attention and money across the whole breadth of the country to improve the delivery of primary health care. Then we have an opportunity to finally get it right with respect to an awful lot of mental illness and the promotion of mental health in primary care settings.
Many professionals believe that collaboration is the key to the provision of quality mental health care in Canada. Collaboration is a process by which consumers, providers, and their communities, each with different sets of knowledge, expertise, experiences, and vantage points, work together to provide more integrated and seamless service delivery for individuals with mental health needs. There are many different approaches to collaboration. It could be a referral to a mental health care provider or as part of an outreach program. This group of professionals is participating in a pilot project. They respond to the needs of family physicians by sharing their expertise. They will meet with the consumer in the doctor's office. They collaborate on the care and support services in a comfortable and familiar setting. Tele-mental health is another way, one that links providers, consumers, and caregivers in situations where distance or isolation may be a factor. So, collaborative mental health care can take place in and across a range of settings. A vision of collaborative mental health care for consumers is one in which consumers are actively involved in the selection and delivery of the health care and support systems that meet their defined needs and goals. Access to health care and related services with the fewest obstacles.
Collaborative care is all about providing the right care to patients as close as possible in their own environment by the appropriate provider in the limited or shortest period of time possible.
Collaborating in that area really requires all of the professions and service providers to care about the patient, put them at the center, and change the way in which they're attempting to deliver those services. Otherwise, collaboration is of no significant value to the patient.
It is within these collaborative environments that patients, families, and caregivers take front and center. It is a patient-centered philosophy, and they are part of the process.
It eliminates a great deal of the stress and the pain and the worry, because caregivers are on duty 24 hours a day, 365 days a year. My son and all the people who are in collaborative care would be able to have the help that they need all the way along their path of recovery.
While collaboration may still be a goal in many urban areas, out of necessity, it has become a reality in northern and rural areas. Here, there are no alternatives to collaboration.
So the collaboration takes place not just because it is, but because it has to for sheer survival and to ensure that people who need services are indeed getting them. What we want to look at, though, is the development of a culture of collaboration so that people do it deliberately and so that they know what resources are available, what they can tap into, so that the patients, the clients, get the best of the service.
Collaboration does exist in a variety of locations, in a variety of circumstances, and in a variety of practices. There are many models. But more is needed if those Canadians with mental health concerns are to be better served. And that is what the Canadian Collaborative Mental Health Initiative is poised to do. Take advantage of current primary health care reform and understand the opportunities it provides for interdisciplinary collaboration and service improvements.
I think it's important on a lot of levels. Very often, if we treat the healthcare system like silos, and you have one patient seeing their GP about something, and a psychologist about something, and a social worker about something, it's not helpful to the client, it's not a good use of the healthcare system, it's not good for the taxpayer. If we can collaborate and each offer our own particular contributions, I think everybody wins.
This initiative, then, brings together a wide range of primary care and mental health care providers to form consultative relationships. Evaluations confirm that family physicians who participate in collaborative mental health care settings have greater knowledge and feel more confident when assessing, diagnosing, and treating a range of mental illnesses. So, from family physicians to social workers to pharmacists, different disciplines, each provides a service that contributes to the comprehensiveness of the care being provided and to the overall well-being of the consumer.
Patients will benefit because the pharmacist is often the only healthcare professional who has a complete record of their medication. Any patient who goes to a specialist and a family physician and perhaps uses emergency services will have records in a number of places, whereas if they use one pharmacy, they have a complete medical or medication record with one healthcare professional.
Well, dietitians are a part of the primary health care system, and they often work also in mental health services. And what we bring is an expertise in food and nutrition. So we help individuals and their families deal with the issues related to their nutritional health, food issues, food preparation, access to food, and so on, in relation to their disease or their illness.
The challenge is to create a culture and conditions whereby frontline healthcare professionals can work together with mental health care providers in a patient-centered environment. While there may be obstacles, they're not insurmountable. By engaging the key players in mental health and primary health care, the Canadian Collaborative Mental Health Initiative will strive to develop strategies that promote and advance collaborative mental health care in a sustaining and cost-effective manner. The primary outcome of this initiative will be a charter, a shared vision of collaborative mental health care for Canada. To achieve this, it will be reaching out across the country to stakeholders, consumers, caregivers, providers of services, educators, and policy and funding decision makers. For the charter to work and the vision to become a reality, your participation and feedback is essential. Can you or your organization support the collaborative mental health care vision? What needs to be done to implement the charter? Tell us what you think. For more information, visit www.ccmhi.ca.